I'm Yervand Hakobyan. I'm hematologist from Armenia, and I'm happy to talk about access problem and how the access can have impact on patient with ALL. And it was important that I find many interesting things that not only the diagnostic problem or drug limitation can be a huge impact of ALL patient journey, but many other things are also very important. And it seems that access is a multi-level problem for patient. It can start it from problems like uh, appointment availability, office hours, because many patients, other patients or parents are working and uh, it's very hard to reach the medical center during the working time for the hospitals. Another problem for access can be geographic uh, problems. It's very, in some countries, the hematology centers very far from another cities or villages, and to reach this center for every month or more usual appointment with a doctor is a huge problem as well. And this kind of access problem can have the big impact on treatment results and survival. Another limitation can be education, and we should work in this direction as well, because uh, limited education awareness can also have impact in treatment and the ALL patient treatment and ALL journey. Uh, of course, big issue can be the healthcare costs. But it's very important to mention that the healthcare cost is not only problem for the countries with low or middle income, but it's problem for even the West countries, from many European countries have this kind of problem. And for many patients, even with insurance, new treatments option or diagnostic tools is big problem and big burden, and it can make some access problems as well. Uh, Another topic that we should mention that it can be the social determination. Of course, it's not usual in many countries, but we still have this problem, and some countries have this kind of problem, and it can again impact on treatment uh, options and treatment results. Of course, more important things for doctors can be diagnostic possibilities and treatment options, because we know that more careful diagnostic journey uh, to understanding genetic profile of ALL patients can help us to choose a more target therapy and go in right way. But in some countries, this kind of diagnostic uh, is impossible to do. And in some countries, even if we can do this kind of diagnostic measuring, then it's impossible to use the target therapy for this kind of patient. We know that more usual treatment option for this ALL patient is chemotherapy. But in some cases, especially for high-risk patients, we have option the stem cell transplant. And this treatment option is really problematic for many countries. Even in these countries, when they have this kind of departments, the price is very high, and many patients haven't access for this treatment option. Of course, when we are going to more newest drugs, target drugs, is becoming that many few countries can say that it's accessible for many patients or for all patients. I'm talking about monoclonal antibodies and about CAR-T therapy. It's some kind of dream or fantastic future for many countries and for many patients. Another problem for many countries and for the patient that possibility to be involved in clinical trials and to have access to new experimental drugs. Again, the clinical trials is very problematic for many countries, and only a few countries, and even in these countries, few centers have access to clinical trials. It's again a big problem, and we need to think about this, and this kind of access again have a big influence patient with ALL. And of course, not maybe last but not least, but not last, about supportive care. We know that now we are using high-dose chemotherapy or stem cell transplant, and in these treatments option, we have many side effects, and we need a supportive care. And without adequate supportive care, we couldn't go to this kind of treatment. In many countries, some drugs, even some antibiotics or some antifungal drugs, very expensive, and access for these drugs in many countries problematic. And again, this problem can influence of treatment and survival of patient with acute lymphoblastic leukemia.